We are joined now by Dr. Enida Friel, who is Head of Monitoring and Evaluation at the Irish aid agency GOAL. Dr. Friel, good morning and thank you for joining us. Is there a different response in each country?
Yes, I mean, well, first of all, to say that although the numbers are small, still, there are cases in nearly every African country now, and certainly in all of the countries that GOAL operates, in 8 of the African countries. There are in total about 10,000 cases in the African continent confirmed, and about 500 deaths. Although this has to be put in a very limited, testing capacity context. In terms of countries, yes, response is different in each country. Having said that, many of the African governments have gone very strong with the public health measures. They have, most of them are in some form of lockdown or emergency situation, curfews. International flights have been suspended. So hopefully, I suppose the public health measures, may work. Having said that, in a way, that's all, they've got. The other, capacity in terms of health systems and the other, food, water, shelter, they're very weak, as we know.
Well, yes, exactly. I mean, we all know the diktat by now, wash your hands, but in many African countries, that's simply not possible because there's no running water or proper sanitation doesn't exist.
Exactly, yeah. That's why the lack of water and sanitation is a huge concern for us. That's why in all of the countries, where we're present, we're making sure that there is access to water and soap. And in addition to that, we are also, distributing information how to prevent the infection. But then also what to do if, somebody is showing symptoms, etc.
Some people might think that because some African countries have recent experience in dealing with the Ebola virus, that may stand to them at this point. Is that fair comment, or are the two scenarios very different in terms of how this virus can be managed and hopefully suppressed?
I think it's only West Africa, a few countries in West Africa who dealt with Ebola. So I suppose, for example, GOAL worked in West Africa, in Sierra Leone, between 2014 and 2016, from the start, to the end of the Ebola epidemic. So yes, as a result of that, capacity has been gained, skills have been gained, and in particular Sierra Leone, for example, all the protocols of Ebola have kicked in. They have suspended international flights for 3 months, and they are now preparing. And GOAL is helping with, contact tracing, creating isolation, space in health facilities, and in addition to obviously, preparing health facilities with PPE and putting water points in either in the community or in the health centers for hand washing, etc. Okay. Having said that, that's not the case, for the rest of the continent. Plus, you're talking about, as I said, very, very weak health systems or non-existence. I mean, countries where we are, like Uganda, is a population of 45 million. They have 55 ICU beds. We know how important that is, to save lives. Or Malawi, 17 million. They have 25 ICU beds. Even Sierra Leone has only 18 ventilators. So I think you cannot underestimate the poor, capacity that it is there in many of the African countries.